Hello, welcome to another edition of Johnny Stocks 212. Other people trying to sell you something. I'm just here to find those A winners, go getters, trend setting companies to invest in. Thank you for joining me wherever you may be. We got a great show for you today. Today, we're talking about an exciting company called Verastem. Please read the disclaimer on your own time. So I'm really excited to talk about Verastem. This is a purely an oncology company that's got some exciting potential medications in phase 2 clinical trials. And really, hopefully, if they're successful, could really help patients. So let's jump right into the leadership team. So Chief Executive Officer Brian Stuglick is the CEO, and Chief Medical Officer Louis Dennis. Now, some people have asked me, what's this RPH stand for? So he's actually a pharmacist in training. Well, he got a degree in pharmacy. That's for pharmacy. MD is medical doctor, and then the COO is Chief Operating Officer. So they got an MD. They have a pharmacist who's the CEO. I'm always looking for companies that have huge potential upside, and you have to look at the leadership team first, because if the company doesn't have fantastic leadership, really doesn't matter. So I've listened to a bunch of interviews. This guy sounds, has a ton of experience, 30-year career in pharmaceutical development. He had a big-time career at Eli Lilly. Basically was head of marketing and global vice president. He was in charge of also oncology, got single approval products for portfolio marketing to late stage compounds, basically over 10 different cancer types. So really outstanding leadership team. The drugs that they're working on basically are on this RAS pathway. Okay, so basically, the most frequently mutated oncogene in human cancers is that RAS pathway. Okay, about a third of all cancer patients are associated with mutation of this RAS family of genes, which can be called KRAS, KRAS, NARS, HARS. And there are other oncogenes, including EGFR, BRAF, that can also activate that RAS pathway, which basically means, it's really awful. It's a higher percentage of cancer, depending on the pathway for growth. And patients with that kind of RAS mutation cancers tend to experience worse outcomes. It's really awful. So they have this VS6766 RAF-MEK clamp in combination with defactinib VS6063, which is a selective FACT inhibitor. And hopefully, if this is proven to be safe and effective, this could be a really good treatment option, depending on what the studies say. But let's look at the pipeline. So the defactinib, all these are in combinations of those two medications I was talking about. If they can control that RAS signaling network through these medications, they have a potential to, really expand treatment options for really some specific subset of cancer patients, which really don't have too many limited options today. Like, for instance, this pancreatic cancer, not a lot of great options. So I'm really excited to look at that VS676. A lot of them are phase 2 trials. So, they've gotten the doses done. They're looking at the safety and efficacy, and then hopefully they move on to phase 3 trials. This is a bunch of different indications. I'm really looking forward to this, the results of the pancreatic cancer one. The reason why they have so many, they got the RAF-MEK clamp inhibitor and then the FACT inhibitor, is because some of these cancer cells can become resistant to different pathways. So I'm really excited to see the results of the pancreatic trial, because that has the potential to becoming one of these agents that could be backbone therapy, standard of care. depending on what the results say. They've had strong preclinical synergy data, using these, and now they're in the clinical stage trials, which is great. They've gotten past phase 1, they're in phase 2. This is potential. The one thing I liked about the VS6766 was, the side effect profile looked pretty good. Twice weekly dosing regimen, which, that really helps patients being on it longer. I mean, twice weekly is a lot better than 5 times a week or 7 times a week. So that's really great. So let's look at the stock profile. VSTM is the stock symbol, Verastem. Time this video, it's trading at $2.75. I do think we're having a little rough spot with inflation, interest rates. The next 3-4 months, it could get cut in half, but I'm still a believer in this company. I think they have a compelling pipeline of potential therapies. I'm going to be following this company because I do think, if these move on to phase 3 trial, you're going to see a bump in the stock, and if they get approved, it's really could take off. So that's all the time I have for the video right now. I will be following this company closely to see what they report. They have a lot of different data that'll be coming out soon. If you did enjoy this video and content I'm creating, please make sure to hit the subscribe button. It's completely free to subscribe. It helps the channel grow. I'll continue to monitor this company, and as always, thanks for watching, and I hope you have a wonderful day.